So good afternoon, everybody. June 17th, 2021, and this is the last of our regularly scheduled weekly updates. And as you can see, we have physicians here to answer your questions, and we have Jill Blake, our Nevada County Public Health Director, to give us where we're at in Nevada County right now. Jill.
Thank you, Pascal. Thank you for hosting this webinar, and thank you to all the physicians who are here. I know that the community, you are trusted messengers for them. I know they have questions for you, so I'm really happy that you're all together. In terms of where we're at today, I can tell you we got an update from the state on Nevada County's numbers. You all have access to their web pages, but some insider information that we got on Monday from the state was that we are currently just over 50% fully vaccinated in Nevada County. So for those who are eligible for the vaccine, age eligible, we are just over 50% fully vaccinated and just over 10% partially vaccinated. So just over 60% of our eligible population has some level of protection. So that's great news. Clearly, we still have work to do. Congratulations and thank you to everybody who has gotten themselves vaccinated. And anybody else who is still experiencing hurdles or challenges, I hope you'll reach out to us to let us know about that. We'll want to get you where you need to be or meet you where you are. As a reminder, the vaccine to everyone is free of charge, although I do want to recognize that for some people there are costs involved if they have to get childcare or if they have to arrange transportation, et cetera. So no fee for the vaccine. I want to acknowledge that some people may still incur costs. And again, if you fall into that category and are having trouble getting over that hurdle, I would say reach out to our public health department. Seeing slow but steady improvements in vaccine, not where we need to be as safe as we want to be. Nothing magical happened on June 15th, although the state did reopen, but we still have some vulnerabilities. And there are certain people who have gotten vaccinated who have a lower response to that vaccination due to age or other health conditions. So it's still important that we remain aware of one another and work to protect one another as well as ourselves. And with the state opening, we really should, and we had a reminder of this last night from the state health officer, that we should anticipate seeing an uptick in cases because that likely will occur as these restrictions go away and people start interacting more. So right now in Nevada County, we have 2 hospitalizations due to COVID. We have 79 active cases, and we add to our case count every day. So don't be surprised if you see an uptick in that, but hopefully it will remain in check. So I hope that's enough of an intro and an update in terms of data and where we are. And then I'll just hand it back over to you, Pascal.
Thank you, Jill, and thanks for being there every week, going through all this with us. And let's jump into the questions that we got ahead of time. So the first question will be for Jill Fitzpatrick from Stephen Sonia. Should people who have had COVID-19 be vaccinated? Why or why not? And aren't the antibodies developed through having COVID as effective as the vaccine?
Hi, Stephen, Sonia, good to hear from you. That's actually a really great question, and I think a lot of people have had that. And we are recommending that people who have had COVID-19 still get the vaccine, largely because we know that although you may have some temporary immunity to COVID after you get it, it is actually only temporary, and that we see over several months that our immunity starts to kind of taper off and then we're not protected again. And we're seeing that people can get COVID again. So it's kind of the same lines that we're talking about the antibody testing. So as long as you have, we can see that antibodies will remain positive in the blood for several months, but those can also taper off. And the levels of antibodies don't always correlate well with how immune you are. So we can't really use that as a guide, unfortunately. So usually we'll say that probably up to about 3 months, you can expect some significant protection after you've had COVID-19, but then after that, it really tapers off and then you're at risk again. So getting vaccinated is still really important.
And teeing off that question, We get some questions, and maybe Alinea, you could take this one. Without being specific, are you seeing any cases of people that are vaccinated and that get the virus? And then also, do you, the county, or any nonprofits need drivers to get people to vaccination appointments? Because we have a lot of volunteers that want to offer their services and drive people. So if you all can chime in, but Alinea first, please.
Sure. So for the first part of the question, which is, can you repeat the first part again? Because for the second part, I'm going to defer to Jill to see if the county needs any help with volunteers. We are doing a Chapa Day, a walk-in clinic, so you can come on in if you're a Chapa Day patient and get your vaccine. Can you repeat your first question, Pascal? I'm so sorry.
The first question is if you're seeing any cases of people who get well, basically breakthrough cases of people being vaccinated, either partially or fully vaccinated, and still catch COVID.
Yeah, so there are breakthrough cases, but they're exceedingly rare. It's like 0.0002% of people who are vaccinated get COVID-19, which is a lot lower than we thought in terms of vaccine efficacy. So it's really reassuring that the vaccines are super effective. And now the people who do get COVID after getting vaccinated, they tend to have very mild symptoms. And they're usually detected when we do something called surveillance testing. So we're checking people who don't have symptoms when they work in healthcare. We are obviously always worried about variants. And so far we found the vaccine's pretty effective against the variants we're seeing. I think there's more concern about the Delta variant and the Delta Plus variant. That is the part that came out of India. And so we are all watching for that. And just to kind of put that out there, the more time we have a population that's not vaccinated, the more chance that we have more emerging variants that can make the vaccine less effective. But for now, we have a really good effective vaccine. So if you're not vaccinated, please do so we can protect our communities from getting to that level, which we've seen, unfortunately, in India.
Anyone else want to chime in on the breakthrough cases?
Well, those rare breakthrough cases that Dr. Stevenson mentioned, as far as I know, there's been no deaths and hospitalizations for people who have been vaccinated with COVID, unless they had some underlying condition that put them in the hospital for that. But it's very, in other words, the people that do get a breakthrough case afterwards, it's mild.
One other comment I would just like to add is that it's helpful to remember, if you're just getting your first dose of one of the 2-dose vaccines, that for the first 10 days to 2 weeks, you really don't have any immunity from it. It takes a while for that immunity to start being generated within your body. So, for example, if I was someone who was thinking about traveling this summer, maybe traveling to Europe, maybe even thinking about going on a cruise, this would be a very good time to start your immunizations, because you could be immunized right now here toward the end of June. In a month, you'd get your booster toward the end of July. And then 2 weeks following that second vaccination, you'd really be at full immunity from your 2-shot series with either the Pfizer or the Moderna mRNA vaccines. And those are both highly effective.
The one last comment I think I'd make is, although, we clearly are seeing that the vaccines are very effective and the rates of getting COVID and getting even serious complications from COVID are exceedingly rare after having a vaccine. We've now, I think, across the world, vaccinated, like, I don't even know the numbers, but over 1 billion people. So we are going to see breakthrough cases. The vaccine's not 100%. And so those ones will probably get reported, and those are the ones you might hear of. But relatively compared to the numbers of vaccines we've given, it's still very, very, very low. The risk of COVID and the complications from COVID are much higher.
And the next question is, are you concerned that we as a county are significantly behind the rest of California in getting people fully vaccinated? And what can we do as well, both what can you do as physicians, and then the general public, what can we do countering maybe some of the mis or disinformation, and also answering questions of people who might have concerns about the vaccine because it was developed so fast, because it is still just under the emergency use authorization.
Well, there's a lot to unpack there, Pascal. But am I concerned? Yes. I mean, I wish our vaccination rate was higher, but I think what we're seeing at UBIDOX is that people are coming in every day for a vaccine. We have the Moderna and J&J vaccines, and you can walk in or you can sign up through My Turn, which is the California software, if you have access to the internet. And if you don't, there's a phone number you can call to sign up on My Turn if you'd rather have an appointment, if you prefer that to walking in. So I think, we're going to see a continued group of people that want to be vaccinated. It's not like the big rush when the vaccine was first came out, but I think it's going to happen. And one thing I wanted to point out, overall in the country, the new case rate, which is like the 7-day average of how many new cases per 100,000 is how the statisticians look at that. So the case rate in the US is the lowest it's been in since 11 months or almost a year. But there was a study that came out looking at in Washington state. If you take out the people who are vaccinated and look at the case rate in unvaccinated people, it's as high as it was in January at the peak of the pandemic. So there's no doubt that this vaccine is effective, and if you're not vaccinated, you're still at risk. I see my internet connection is unstable. I hope you could hear what I said there, but.
Yes, we were able to hear you, but your picture froze up for a while there.
And I just want to add to the concern about the vaccine being rushed. I know we hear that a lot, but just to be clear, there were no steps that were cut from the scientific process. There were some administrative steps that were cut. They were given unlimited resources to get this done. But the same rigorous scientific process and regulations have been placed on this vaccine. In fact, it's been scrutinized, I think, more than most vaccines that have come out because of the seriousness of the pandemic, and because we want to make sure it's a safe thing that we are providing folks. So there's been multiple regulatory bodies looking at it, and it will get FDA approval soon. I think they've actually submitted their data, which is very, very promising. So just to speak.
And the thing about it being rushed, I mean, this is built on a couple of decades of research. mRNA vaccines are not new. The technology was developed in about almost 20 years ago, and research has been going on since then. These are the first mRNA vaccines approved in humans, but it's for an infection. But this technology has been well studied for the past 20 years, and like everybody was just like keyed up and ready to go when the coronavirus is identified. They were prepared, and that's why it was able to be rolled out so quickly. It's not like this is a new thing, this mRNA technology.
And we had one one question that came in is that actually Dr. Lace answered in the Q&A, but let's repeat it for everyone. How long is the vaccine effective, and do we actually know? So John, could you
Well, I just cut and pasted what the CDC says, and the answer is we don't know yet. There's no evidence in the 9 months or so since vaccines have been tested that there's any decrease in effectiveness so far. But we will know as time goes by if we see any decrease in effectiveness or not. And then a related question that people often have, well, is are we going to need boosters? And the other answer to that is we don't know, possibly, but the current vaccines were effective against the variants that we've discovered so far, because they work against the spike protein, which is the knobby thing on the virus picture that everybody has saved as a meme. And that is a fairly conserved protein, which means it doesn't have a lot of genetic variation. And I just want to say one other thing, is that the mutation rate of the coronavirus is a lot lower than the mutation rate of the influenza virus. So it's unlikely that we would need annual vaccines for the coronavirus. But I'm just a small town lung doctor who's trying to learn how to become a virologist and an epidemiologist all of a sudden. And while I have the microphone, I just want to say thank you to the other members of the panel who have done such excellent work at making vaccines available to the community. That's not been in my scope of my work, but I've been very appreciative. And we have not seen a single vaccinated person admitted to our hospital with COVID. Thanks.
I think that Dr. Lace raises a good point. The flu mutates once every 15 minutes, and we're seeing, so it's more of a genetic drift with the COVID-19 vaccine. So it takes a lot longer, and it's really encouraging to see immunity after 8 months. So hopefully that will be longer.
And actually the question about boosters, I think that actually it was this morning in the briefing, the COVID-19 briefing that the White House task force had, and the same thing. And it was like, well, maybe in a year, maybe in 18 months, maybe never. We just don't know that. But something that's way more immediate. Can we have an answer from all of you? Are you comfortable with indoor dining at full capacity since we have lower vaccination rates in Nevada County?
I mean, to be candid, it does make me nervous because not everyone is vaccinated inside.
Well, nobody's answering. Go ahead, Alinea.
It does make me nervous because we have a lower vaccination rate, and I worry about people not being vaccinated inside. I do tell my patients who are vaccinated but are immunocompromised to still wear protection when they're outside, because we don't know if the vaccine is as effective maybe in them. And I think we're just gonna kind of have to see how things go. I would still continue to recommend being safe. This pandemic is not over yet, and we just don't want to go backwards.
Yeah, that's about where I'm at with it too. I'm not totally comfortable being inside with everybody unmasked, not knowing who's vaccinated and who's not. As a healthcare provider, I am, but it does make me a bit nervous.
I agree with all of that. And I think the more that, I have concerns for my unvaccinated patients as well as the unvaccinated people in the community. And I also want to be aware that there could be kind of a reverse feeling of being singled out for wearing a mask. And I hope that everyone can just continue to respect everybody's decision about whether they're masking or not. And if you continue to mask, it's still providing a lot of safety for you and for the people around you who may not be vaccinated. And I agree with Dr. Stevens that we do have a lot of patients who are still, or community members who are still compromised. And the more COVID that's in the community, the higher risk it still presents to them, even though they've taken care of their vaccination.
I could add to what Dr. Fitzpatrick said. There are people who are immunocompromised, and especially at healthcare facilities. So the dictum that you don't have to wear a mask anymore, it does not apply to healthcare facilities, and that's the reason, because there are a lot of people there who have various illnesses or taking various medicines that make them immunocompromised. So, please respect that when you come to our clinic or any other healthcare facility. And I totally agree with Dr. Fitzpatrick. You don't know what other people are, what conditions they have. So respect people's choice to wear a mask is my plea.
I'm respond to verbally to, is it Rach Wood's questions? Whether it's safe to hang out inside if everybody's vaccinated. And I would say if everybody's vaccinated, you can hang out, you can hug even for a long awkward time. And but if someone is not vaccinated, or if you know that they may be immunocompromised, like for example, a organ transplant patient or a chemotherapy patient, they don't respond as well to the vaccines. So they may need, those people may benefit from boosters, but we should be honoring and careful around them, like to echo what Dr. Hicks said.
I think that the benefit of the vaccine is it allows us to be around people who are vaccinated, which I think the harms of this disaster that we've all gone through is that social isolation and depression, and we've seen higher substance use disorder issues as well. So getting vaccinated is our way out of this disaster together.
And I just want to comment on what Jane Milner put in the Q&A. You're absolutely right. The mask off is for vaccinated people. The governor's proclamation and CDC's, it applies to vaccinated people. So if you're not vaccinated, please still wear a mask and socially distance.
And consider getting vaccinated and with the with people who are willing to be vaccinated, there are a lot of options. If you go to myturn.ca.gov, you call 1-833-422-4255. You can make your appointment. There are walk-ins available at the public health clinic, if I'm not mistaken, and there's also there's help with transportation. And of course, if you really have transportation issues, there's always the option to reach out to the community, because like I said, we have a lot of people who emailed and said, hey, if anybody needs a ride, I am fully vaccinated. I'm happy to show them my vaccine card, and I'm happy to give rides. So, but you can always get the ride, and even now you have Uber and Lyft that are providing free rides. And I believe our final question today will be, what about a person who is vaccinated but works in a public setting like a store? Should they still wear a mask, both for themselves and for the people they come in contact with?
My opinion on that is you don't know about the people coming in your store, whether they're vaccinated or not, I'm guessing. And if the store is not requiring vaccines, masks, I mean, um, in my opinion, since you don't know if you're around vaccinated or unvaccinated people, the safest thing is to wear a mask.
And I think it depends on your level of risk, I would say. So, I mean, the chance of you getting, if you're fully vaccinated, the chance of you getting COVID is very, very low. Like we talked about, the breakthrough infections are very low. But if you are immunocompromised or you live with someone who is, you may want to do that extra protection step and wear that mask if you're being exposed to a large amount of patients or people.
I would agree with that. And also, I mean, everybody's situation is different, not understanding what your own medical situation is, but to kind of piggyback on the home situation, we yet don't know for sure if we can still harbor the vaccine or harbor the virus, even if we're vaccinated, and then carry it to someone else who's, compromised. So, it's thinking about that. If you have a high exposure rate in your workplace, then you're just much more likely to come in contact with it, even if you've been vaccinated.
And okay, well, we now, of course, now the questions are coming in, but if you have small children under the age of 12, is there a cause for concern for exposing them if you're vaccinated, or even, and especially if you're not vaccinated?
I think a lot of us were hoping that vaccines would be open to that age group before we went fully open, because yes, there's a lower risk of them having death or hospitalization, but there's still some risk of them having long COVID. And for folks and for kids who have underlying medical conditions, they may be an increased risk of that. So I think it really depends. I have a kiddo with special needs, so I'm going to keep my mask on even though I'm vaccinated. And so it just depends on the situation, and making sure that you protect your kids the best way you can.
And speaking of long COVID, do we have any idea how many people get long COVID?
There's various opinions on that, and they're ranging from about 10%. There's that was published in U.S. Medical literature. A study in Britain found that 1 in 7 people have symptoms 3 months later, and then there was just a study released by Fair Health. It was published a few days ago that tracked the health insurance records of 2 million people in the US and found that almost a quarter of them, like 23%, had new issues that had not been diagnosed before they became infected with COVID. Now, there's limitations with that study. For one thing, it only covered insured people, so people without insurance who are at higher risk. The people with private insurances were in the study. So other people who might be at higher risk because of, wealth equals health in this country and elsewhere in the world, they were not included. But still, that's a pretty high number. So I think the jury is still out on that. From what I've read, it does not seem to correlate with how serious a case of COVID you've had. People with mild COVID can have symptoms long afterwards. The most common symptoms are persistent loss of sense of smell or taste, a cough, shortness of breath, and fatigue, and some other neurological symptoms like brain fog. Anybody else want to jump in on that one?
So there's a wide range of symptoms which underlines the case that COVID is not just a respiratory illness, it's a multi-system illness. It can affect the heart and the mind and the brain. And there's a increased risk of depression that probably is greater than what you might just see from the adjustment disorders of illness. So it's more of an organic thing. And folks that have been hospitalized have a significantly increased risk of rehospitalization for other conditions in the 6 to 12 months after they've been hospitalized. And if they've been hospitalized and end up going home on oxygen, many of them remain oxygen dependent.
And that's yet another reason to get vaccinated, because ventilators are not fun, and definitely long COVID, and with what you can expect, and brain fog. I already have enough trouble getting through a normal day without brain fog. So with that, we're got a little bit over time here. So I want to thank each and every one of you very much for joining us for the final regular webinar, and special thanks to Jill Blake and everybody, and Scott Kellerman, Glennah Trochet, Ryan Gruber from Nevada County for being there every week and getting us the information, getting the education. And to all of you physicians, thank you so much for what you do to keep our community healthy and safe. And everybody stay cool, hydrate a lot today because it's really hot. Hot stands for hydrate often today. And with that, thank you, everybody, and be safe out there.
Thank you, Pascal, for doing this. It's a real service.
It's been excellent.
Thank you very much.
Thanks. Bye, everybody.
Thank you, Pascal.
Bye, Jill.
Thank you, Pascal.